Hello, students. In this session, we will look at the kidney. This illustration shows the anterior view of both kidneys. The right kidney lies at a slightly lower level than the left, while the left kidney sits a little closer to the median plane. At the hilum of both kidneys, the right and left renal veins are visible anteriorly. The medial border of the right kidney is closely related to the inferior vena cava. The superior poles of both kidneys are in contact with their respective suprarenal glands. The left gonadal vein drains into the left renal vein, while the ureter continues downward from the lower part of the renal pelvis. Behind the kidneys, the psoas major and quadratus lumborum muscles form the muscular relations to their posterior surfaces. The first lumbar nerve can also be seen coursing in this region. Finally, superior to the left renal vein, the cut end of the superior mesenteric artery is visible in this illustration. This illustration of the axial plane shows the location of the kidneys in relation to the vertebral column. The posterior surfaces of both kidneys are closely related to the psoas major and quadratus lumborum muscles, which are clearly visible in this section. Anterior to the right kidney, the liver and the descending part of the duodenum can be seen. The inferior vena cava, IVC, lies close to the medial border of the right kidney, while the abdominal aorta runs along the medial border of the left kidney. Notably, the left renal vein crosses anterior to the aorta, a key feature visible in this axial view. This illustration shows the medial border of the kidney with its hilum. The kidney has a distinct upper pole and lower pole. Near the upper pole, we can see the cut end of an aberrant or polar artery. This vessel supplies the poles of the kidney without passing through the hilum. Within the hilum of the kidney, from anterior to posterior, lie the renal vein, the renal artery, and the renal pelvis. The renal pelvis continues downward as the ureter, which carries urine away from the kidney. This image shows the longitudinal section of the kidney, highlighting the formation of the renal pelvis. In the section, the cortex and medulla of the kidney are clearly visible. Within the medulla, the minor calyces join together to form major calyces. These major calyces then unite to form the renal pelvis. The renal pelvis continues downward as the ureter, which drains urine from the kidney. At the pelvi-ureteric junction, there is a natural constriction, an important landmark in the urinary tract. This illustration shows the anterior view of the right kidney with its coverings. The kidney is enclosed by the renal fascia and perinephric fat, both of which have been cut to reveal the underlying structures. At the upper pole of the right kidney, the right adrenal gland is visible. From the hilum of the kidney, the renal vein drains directly into the inferior vena cava, while the renal artery arises from the abdominal aorta. At the lower part of the hilum, the ureter can be seen continuing downward. The right gonadal vein also drains directly into the inferior vena cava. Behind the kidney, the psoas major muscle forms an important posterior relation. Superiorly, the cut ends of the hepatic veins are visible in this illustration, completing the view of the right kidney and its coverings.